Welcome once again. I'm Nurse Kodia, a registered nurse currently practicing in the United States. Today, I want to share with you on how to study for the Nclex. I consistently studied for 2 weeks and I passed the Nclex at 85 questions. Watch this video until the end to find out how exactly I did it. So, first things being first, you've gone through nursing school, you've graduated, congratulations, you've made it through, right? That's a big thing to celebrate. You did it. And if you did that, trust me, you can study and you can pass the NCLEX on the first try. No need to panic, no need to fret, okay? This is exactly how you can do it. And I guarantee you, this will reduce a lot of your tension, your anxiety. I just want you to relax, take a deep breath, and know that you made it through nursing school, you passed your courses, and the NCLEX is nothing out of the norms of what you've seen. It's information that you're familiar with, and you can study and you can pass on the first try. So the first thing is you want to identify what kind of learner you are. If you made it through nursing school, you can identify what were the best ways that you studied while in school. Just because you're studying for the NCLEX is not the reason why you would look for different strategies and a whole new way of studying because you're studying for the NCLEX. No, you want to identify what is already working and what you're going to do to amplify what is already working. So are you an auditory learner, meaning that you learned more or you were able to understand more when you listen to your class recordings, when your teacher was talking in class? Was that the best way you were able to absorb the information that was being taught to you? Were you a kinesthetic learner? Did you learn best by doing when you were in action? And for someone like you, maybe you learn better when you are at clinicals. For me, sometimes I found out that by doing, it was easy for the things that I was learning to stick to my memory. Are you that kind of learner? Are you an interpersonal learner? Meaning that do you learn better in groups? Do you learn better when someone is explaining the information to you? Do you learn better when you're sharing information with other students, your peers, or even on one-on-one with your professor? There were some students during my time that would ask for a one-on-one session with the professor. I did that a few times where I would, say I wasn't understanding this. Can you help me explain this particular subject so that I can understand it better? Maybe you're just that kind of learner. Okay. Next, are you a solitary learner? For my people back home, you know exactly what I'm talking about. Way some people were trained to study by yourself. Is that how you best absorb information? Did you notice that while you were in school, you just like to have your time once you got back from school to study, and that was how you were able to understand the situation? For me personally, when I was in school, I do enjoy my solitary time of studying. Like even when we had group sessions and we wanted to study in groups, I would make sure that I had my solitary time. I studied, I understood the information, how I best wanted to understand it, and then I went for this group session. It also helps you to better understand what is being discussed in the group sessions. You're more effective, you're able to ask questions, and you're able to also share your knowledge. And by sharing your knowledge, your happiness stick. I have mentioned 4 different kind of learners, and do you identify with one? Well, all you have to do is stick to that method and add other strategies to it. It's not magic. You can do it. You've already done it. Next, what area in school was your subject challenge area? What class did you find was a challenge to you than the other classes? For instance, I know that when it came to pharmacology, I had to do more studying because I felt as though that might have been a little bit of my weak area. And so it's good to identify this, because when you begin to study for the NCLEX, yes, I will talk about how you want to study exactly for that, but you don't go ahead and study without knowing your weak areas. You want to be very comfortable with your weak areas and make sure that you studied well enough for that before you move on to taking the Nclex, and before you even move on to do an accumulative study. So how I studied was that I started with my weak areas. If you want to be effective and you're planning on taking your test within a short period of time, you want to make sure that you study to an extent that you're comfortable in this weak area. And you want to study effectively. You don't want to spend the whole time just focused on that area. Okay. I'm just saying give a good amount of time, like 2 or 3 days, just to that subject area. And while you're giving more attention to that subject area, you're also including other areas in your study time. Next, the percentage of subject areas on the NCLEX. And I'm going to leave the website to which you can find this. You want to know the highest content areas that are covered on the NCLEX. Each area has a percentage, and some might just be 10%, some might be 18, some might be 12, some might be 13. This now helps you study strategically. You want to study strategically, okay? You don't want to waste your time, and the only thing you're studying is PEDS, maternity. You do not want to do that. And this is a very important tip. Just because someone told you that they got a lot of maternity questions on their exam, they got a lot of PEDS questions on their exam, does not mean that is the way your test is going to be structured. Nclex has an algorithm that it goes by, and it's based on your personal algorithm. Like, however you're answering the question, that's the kind of questions that are going to keep coming to you. So what might show up for one person will not be the same exact thing that will show up for you. And I'm sure you must have learned this in nursing school. So be very mindful of using what you heard from another person to implement it within your studies. We talked about being strategic, right? When you're being strategic, especially if you have a short period of time to study before taking your NCLEX, you want to do an accumulative study. You already know the percentages, so you want to spend a lot of time on the higher percentages. And next, you want to make sure that you're doing an accumulative study of the subject's area. I don't care about if you're very familiar, you know exactly, how to answer questions in this particular topic or subject area. You still want to go ahead and study. And while you're studying, you want to look at the rationales. I don't care how comfortable I was, how many times I looked at hypertension, the cardiovascular system, the respiratory system. As I was answering questions, even the one I got right, I looked at the rationale for those questions. What I personally use to study? There's so many resources out there, but for me, I first of all use the ATI. My school purchased this ATI packet that could help students prepare for the NCLEX. So with that package came questions that you could answer, and then there was a test at the end: foundation of nursing, med surg, complex care, everything. And it helped you look at each course in detail. And then at the end, there was an accumulative test that you had to take, and it told you how ready you were for the NCLEX. So I believe I got like an 80 something percentage of passing the NCLEX. So I use that. And then after that, I use UWorld. I would suggest it. It's amazing. And I believe that it's structured like the NCLEX. So you're going to see next gen questions on there, which are scenario based questions. And based on those scenarios, you're going to see questions following that are related to the topic, and you're going to answer those. So ATI did use an next gen questions as well. UWorld does use the next gen questions, which is being implemented in these questions as of now. They have another name for it. Well, you know what to expect. Okay. So you want to go ahead and study with materials or study with a resource that has been formulated based on what you're going to see on your exam. And you were offered me this. It was easy to understand. They had great rationales, very detailed rationales that explained to you on what you were saying. And what I liked about it is that the questions you've had wrong, you could always go back and make a list of just those questions you had wrong, look at it, study it, review it, and you will see that the more you practice it, you will start to get it right. Because the reason why you're getting it right. So if you just leave it as that and you move on to the next topic without going back to look at it and make sure that you've understood it, then you're missing content that will be important for you to know. I also used Marklimic videos. I downloaded Spotify. I listened to the videos on there for free. They were amazing. I mean, I drove anywhere within those 2 weeks I used to study. I listened to those videos. They were very instructive. Not only can you find it on Spotify, you can also find it on YouTube. That's what I'm trying to say. You can find it on YouTube. There's so many of those videos and they are very helpful. It's like these people have an Nclex brain because going to see that some of the things you see at the Nclex, you are able to understand it through these videos that were explained. They are very Nclex savvy and they truly know how to bring this information to you in a way that you can easily understand it. Very, very instructive and nice. All right. So yeah, we talked about reading the rationales, taking test preps to know exactly where you are. You will offers this as well. Done the accumulative study of foundations, complex care, pharmacology, because you're grouping those questions together to answer them. Once you're done with that, they also have an accumulative test that you can take. I think about 2 or 3 of them. I only took the first one because of the amount of time that I had to take the Nclex. However, it told me that I had about, I believe, an 80 something% of passing, which is not bad. And I took my Nclex and the results were great. So how did I study in 2 weeks? So guys, before I decided that I was going to take 2 weeks to study, I was a nerve wreck because I asked myself, how am I going to do it? I had searched videos on YouTube, how to study in 1 month. I took the Nclex exactly 1 month after I graduated. Mind you, within those 1 months, I was working. I didn't really study within that 1 month. But what I did is towards the end of my semester, when I was at work and I had downtime, I would go to UWorld. I would do like maybe 5 questions during my shift, 4 questions during my shift, 10 questions during my shift. Hey, there weren't a lot of questions, but I know that at least I was looking at something. I was learning something, which is what was important to me. But however, that wasn't consistent at all. And so I told myself that, you know what, I'm working, I've got bills to pay, I have responsibilities. And I started looking on YouTube how to study in 1 week, how to study in 1 month, how to study in 2 weeks, how to study in 3 weeks. And guess what? I found nothing. And I said, so I'm really going to be the only one that studies the Nclex in 2 weeks because I mean, no resources out there that could relate with what I was trying to do. So I said, you know what? I know that when I put my mind to something, I can do it. And if I called off work for exactly 2 weeks and I studied consistently, I knew that I would be ready. That was just how much confidence I had in myself. Now, am I encouraging people to study the Nclex in 2 weeks? Absolutely not. I want you to find out exactly how I studied in these 2 weeks. Okay, it was an intensive process. I would suggest that you take your time, you study, and you're sure that you understood the information that you study. That's the goal of studying. The goal is not just to give yourself a certain amount of time and go take the Nclex. I had told someone that this is what I did, and before I knew it, they went to take the Nclex and it wasn't effective. So my strategy does not have to be your strategy. When you're studying, you're able to tell if I understand the content or not. You're able to tell if I'm able to interpret the information well enough. I'm confident enough to the point that if I was sitting in front of an exam, I could understand a variety of different diseases. I can understand the different subject areas that are going to be covered in the Nclex, and you understand it confidently. You're never going to know everything. I love what someone had told me. You're never going to know everything 100%. But at the same time, you will know what you know is enough and is reliable enough for you to make critical decisions, or for you to critically think and decide what your answer choice will be. You will, I say, when you find the one, you'll know. When you study enough and you studied well enough, you will know. So yeah, I studied consistently for 2 weeks. And how I did it was I went to the library every single day for those 2 weeks. You heard me right. Every single day. For how long did I study each day? For at least 7 hours. Mm-hmm. What I did, I studied for exactly 7 hours. And within those 7 hours, I took short breaks, mini breaks, right? Either to eat, to use the restroom, or just to go outside and get some fresh air. It was the summertime. And, for about 5 minutes, replying messages, listen to a song if I wanted to. Went back into the library and continued to study. I brought my food to school because I used my school library, and I would heat up my food there and I would eat. I'm sure the cleaning ladies were already familiar with me, like, hey, what kind of book is this girl studying? And it's even summertime. But I was there every single day. I had a goal in mind. I wanted to achieve what I wanted to achieve within a certain time. And I did that every day. And guys, yes, there were days that I studied for more than 7 hours. Yep, I did that. I'm going to be putting up a video of where I was dancing. I think it was like one day before I took the Nclex. And I was feeling so anxious that I said, you know what, I had to do something to relieve the tension, to relieve the anxiety. And this is very important. When you're studying, know how to manage your stress. You have to find a way to relieve your stress. You cannot study under tension. I, for one, cannot study under tension. I don't think anybody can study under tension. If you're very pressured and you're thinking of a lot of information at the same time, it's going to impair the way you study. Okay, so you want to make sure that you're able to ease that. And I did that by dancing. Once I danced, my mood was calm. I stood by the window to look at nature, just little therapeutic things. Don't overcarry it on your head. Please don't do that. So while studying within these 2 weeks, what I did is that each time that I got out of the library, got into my car on my way home, I listened to Mark Klimic videos. That was just a refresher for me. And anywhere I went, I listened to Mark Klimic videos. Now, another tip I want to add is you have to be very disciplined. Events might come up, you might have to say no. I don't care what kind of thing it is, you would have to cut down on fun for that period of time because you have a focus, you have something that you want to achieve that is important to you. And if it's so, then you have to prioritize what you have to do. You might have to say no to a lot of things. You might have to say no to a lot of outings. But hey, it's just for that period of time. And your loved one should understand that you're trying to achieve a goal and you need that period of time to concentrate. So that's just a few things to mention. If you have any questions, leave it in the comment section. And thank you for watching.